Hi, I'm Dan Hust, Sullivan County's Communications Director, here speaking with Amanda Wolfe, an RN for 17 years actually, and our community health nurse, who is also with our epidemiology division and our public health services, basically leading the team that is battling coronavirus in Sullivan County. Amanda, thanks for joining me today. I
You're welcome.
appreciate you being here, especially since I'm sure you have been crazy busy. But what I would want to talk to you about today, and I think a lot of people would like to know more about, is contact tracing and how you investigate and follow up on people who have been either tested positive or been exposed to somebody who was infected with COVID-19. So first off, I think I'd like to ask, we hear this phrase a lot. What does contact tracing mean?
Contact tracing means that when our public health department is informed or we're made aware that somebody has tested positive for the coronavirus, we contact that person and we work diligently to identify all of the individuals that they may have come in contact with while they were considered contagious.
Okay.
By doing this, we're able to identify who could then also become ill with the coronavirus. And if we're able to help people identify that they've been exposed and in turn limit their movements, we reduce the spread of the illness into their own families and into the further community.
Okay. That said, then let's my brain, I think, works best chronologically here. Let's start at the beginning. How do you first become aware of a potential COVID case? Because to my understanding, at this point, at least while we're talking, public health itself has not been doing the testing. Other doctors' offices, hospitals have been doing the testing. So how do you become aware that somebody potentially has COVID-19?
The laboratory result comes to us through a state computerized system, or we're informed by a doctor's office and then given a laboratory result.
Okay. And then what happens then? What does your team start doing?
Well, we then contact the person who is positive and determine their whereabouts and who they were in contact with during the time that they would be considered contagious.
And how difficult is it to get in touch with people? Have you found that to be very challenging, very easy?
Well, what we need are good phone numbers. If accurate information, what we need is accurate contact information. So once we have that, people need to answer the phone and talk to us honestly. So.
And again, have you found that to be a particular challenge, or most people are usually answering the phone when they see it says public health services on their caller ID?
I would like to say that most people are receptive to our outreach.
Okay. So then you get them on the phone, and do you have a script that you follow, basically something that is a standard language that you use with everybody? I understand you'll have, for Spanish speakers, you'd need Spanish, or English, you need English, but in terms of just what you're telling people, is there, like, I know 911 dispatchers, for example, have a script they follow when people explain to them that they have a certain emergency or medical condition. How does that work with your team?
Yeah, we have forms that we do follow that help us to make sure that we're gathering all the information that we need. It helps keep the conversation on track.
And if you could just explain really quickly, what are the information points that you're really trying to elicit from the people you're talking to?
Well, we want to know how they're feeling. When did their symptoms start? What symptoms do they have? Do they have support at home? Who else have they been in contact with, close contact with? Were they going to work when they were symptomatic? Do they have enough resources to stay home? Because once they're positive, they shouldn't, and they're aware that they're positive, they shouldn't be going out to the store. Or their close contact should also not be going out to the store. They would be on either isolation or quarantine. So we're trying to identify that, we're trying to relay the information to them that they're positive and that they understand their isolation or quarantine status. And then we want to make sure that they can do that safely at home. And then we take that information along with their symptoms. We discuss, the importance of hand washing and maintaining social distance, to decrease the spread of the virus further.
Now, you said something interesting about that they can isolate safely at home. What if they can't?
We have contact information that we can give them so that they can reach out. The county has the emergency department that can help with giving them support.
But you're also, I'm sorry, go ahead.
I said I don't know the phone number right offhand, but
No, that's fine. Yeah. So the fact though is that most, or if not all of these people you're talking with have already potentially exposed somebody else, at the very least, probably a family member, if not a coworker or something. So
correct.
Do you have to follow up with each of those people that they potentially exposed?
Yeah.
Or for example, but let me ask, for example, if it's like a fellow family member who lives in the house with them, would you want to talk to that family member directly, or would you tell the person who was infected, please share this with your family members? How does that work?
It depends on the conversation. I mean, I've often had people put me on speakerphone so that I'm talking to everybody in the house at the same time. But if somebody's already been made aware that they're positive, because when people get tested, they're instructed to go home and socially isolate from their families. So I have called a household and then had, someone's husband's cell phone because he's staying on the other side of the house. So you can potentially have to call each person individually. It just depends on the makeup and the dynamics of the family situation.
How long is a typical conversation when you reach somebody? Is it 5 minutes, 10 minutes? Is it different each time?
It's different each time. Conversations can last, I would say, probably no less than 20 minutes, but they can go as long as an hour. It depends on how many people somebody's come in contact with and how complicated their case is.
My goodness, though, you've had probably hundreds upon hundreds of people you've had to contact since this began. How do you find the time to call each one and have a 20 to 60-minute conversation?
Well, we just are here and we just keep making phone calls.
Right. Because I would think that becomes a 7-day-a-week operation.
It is. We are working 7 days a week right now. Yes.
Because there's really no time to waste. Once you find this out, you need to get in touch with people relatively quickly. So
yeah, time is of the essence. It's very important that if somebody's positive, that they're made aware as soon as possible so that they can isolate, and those individuals that were in contact with them can be made aware and they can quarantine appropriately. It's the only way to extinguish the spread of the virus.
Mm-hmm. We do a public dashboard every day of the week, weekdays, showing people who are active cases, cumulative cases, those who recovered. Would that figure be accurate as to approximately how many people you've called, or would it be beyond that number?
No, we have a team of nurses that does the initial investigation, and then we have a separate team of nurses that does the follow-up calls, because not only do we call people in the beginning to make them aware, we also call them throughout their isolation and quarantine period to see how their symptomology is progressing, when they're getting better, when can they be released from quarantine. So there's a lot of people working on the phones to follow people throughout their disease course.
And this isolation and quarantine period is what, 14 days?
Yes, for the most part, yes.
Yeah. And so you're calling what, daily or weekly to when these people are?
The follow-up calls are about every 3 days.
Okay. Boy, but that adds, especially as the numbers grow with people in isolation and quarantine, that's a lot of phone calls. I'll put it that way.
Yeah, I've never been on the phone so much in my life ever.
I can only imagine. This isolation and quarantine, is this voluntary or mandatory?
It's mandatory.
And have you found compliance for the most part?
I think that most people are in agreement with being compliant with whatever guidelines we give forth to them. People are very interested in protecting their families and their communities.
What happens if somebody is not compliant?
We can, especially if we find out that somebody is truly not being compliant, we can, bump it up the chain of command, and law enforcement can get involved and maybe make a visit to somebody's house or to a business that we feel is behaving in a way that is not conducive with maintaining the spread of the virus or reducing the spread of the virus.
Yeah, because it's a serious
Yes,
issue.
it is very serious. It's definitely serious. And yes, I think that if law enforcement shows up at somebody's house, it helps to confirm the gravity of the situation.
So after they are finished with the isolation and quarantine, do you do any follow-up after that?
Once they're released, we speak to them and then let them know that they're released and that they can go back to work, but that they need to remember that they need to continue to maintain social distancing, and to, it's not that when somebody's no longer ill that they have, free range to just go to the store every day. Because right now we're still maintaining social distancing and we're asking people to stay at home, those that are well and those that are sick. So they're allowed to return to work if they're considered an essential employee. Otherwise, we tell them that they're no longer considered contagious, but to please continue to follow the guidelines that are the norm for everybody currently right now. And we really have to remember that this is a new virus. So the science is constantly changing. So information we have on Monday, it might get tweaked by data that, the government scientists have, accumulated just over the week. So if data changes or information changes that you hear on the news, or something that we tell you is different than what you heard 2 weeks ago, it's because everything's still new.
Yeah.
And it doesn't mean that people were wrong. It means that we're learning as we go and using the best science that we have in that moment. And
that may be the most important thing you've said in this whole interview here. I even learned something just from hearing that I was mistaken on. So I'm glad I asked. So once this is all done, though, it's not done for you guys. You have to keep plugging away at this. So how are you supporting one another and helping keep each other's stamina and spirits up as you go along?
Caffeine and humor. Nurses have a sense of humor. It's probably a job requirement. They just don't tell you about when you go to school.
Yeah. Well, I'm glad that you brought that with you and didn't have to learn that sense of humor on the job. The fact, though, is that this is very rigorous work, and I think it's probably somewhat draining, isn't it? With all the effort you have to do. I understand you have the caffeine and the humor, but let's be honest here. This is probably a very intense period, possibly the most intense you've ever experienced as a nurse. Yeah, it definitely is. And you have to balance being able to go to work and give it your 100% and still maintain your family life and trying to keep yourself together. And but it can be very distressing at times. You just have to remember to get up and take a walk, get away from your phone, and get perspective. Perspective's important. Is there anything the general public can do to, show their appreciation or just help out and make you feel better about things when you're going through a stressful time? Well, I think that what we would ask the public is for them to follow the state guidelines and social distance and stay home. Mm-hmm. That would be the gift that they could give all health departments and all nurses and doctors and anybody working in healthcare, is to please follow the guidelines, wash your hands, social distance. And the sooner we're able to accomplish the downward slope of this virus, the sooner we get to go back to, what we may have thought of as normal societal behavior. Yeah. I think that answers the questions I had. Is there anything else you'd like to talk about? No, I just want to thank everybody for their cooperation when we call. And if you haven't heard from us yet, and you do hear from us, we just appreciate your cooperation in advance. Amanda, thank you for what you and your team are doing. I believe we're coming up on National Nurses Week, so this is particularly apropos to extend our our really heartfelt gratitude. You guys are a front line that isn't necessarily always that visible, but is super critical to making our way through this crisis. I don't know another term to use. And the effort you're putting in does not go unnoticed and is truly, truly appreciated. Thank you.
Thank you.